Hey, it's Dr. Amanda from StraightSmile Solutions, StraightSmileSolutions.com, and today we're going to be talking at high level about virtual consults and virtual check-in software, how to streamline appointments, how to have less in-office appointments, how to convert starts easier for aligners and braces patients. So these are my four top companies for virtual consults, virtual check-ins. All these companies can actually do both, although they were initially developed maybe towards one or the other. So I'm going to give you a brief history on each of them. I do have individual videos on all of these as well if you want to dig into it a little bit more. And keep in mind that these companies are rapidly evolving. So the price points I might be mentioning might not be accurate. It might be likely more expensive. But also it can be less expensive if you asked to not do month to month. My question, if you're on some type of budget or you're looking for something, just ask. Just ask. And some of these really were focused more towards orthodontists, and then they scaled them to general dentists. So they may not have like a smaller package, but you can always ask. And I found a lot of them are pretty cool if you don't have that much volume, to see if you can scale things down a little bit. So, okay. So without further ado, I'll dig into all four of them. So let's start with the big kahuna, which is DM or dental monitoring. That's this red one down here. This was the first one to come out. And this company came out, goodness, maybe 2014 or earlier. It's a pretty robust company. It has a lot of AI or artificial intelligence. It also has a price point to match. So if I were an orthodontist with multiple offices, multiple doctors, thousands of patients, this is what I would pick, right? But if I'm a GP or a pediatric dentist and I only have 10, 20, 30, 40, 50, 100 cases, would I pick this? Probably not. It's probably more than I need, And price point is onboarding is a couple thousand. I don't know what it is now. And then per patient per month, you're going to be paying somewhere between $11 and $15 per patient per month. Maybe they have something different, but it adds up, right? So yeah, if you're charging $7,000 per case, that makes sense. But if you are trying to do white label or in-house and trying to keep your prices and overhead low, this may not be possible for you. But it's pretty cool. There's a good dashboard, there's an app. So from the patient-facing portion, there's an app. From you as an office, there's a dashboard. You get alerts. You have all kinds of permissions. Patients can check in. You can pretty much totally eliminate visits in between when you need to see them, because the computer software will recognize things like an aligner unseat and send you an alert and let the patient know. And you can program it and onboard it for the way you want to practice. And it'll escalate with the AI if a human needs to look at it, right? So you're basically using robotics or artificial intelligence. Now they have a dumbed down version, which is maybe more towards $10 or $11 per patient per month, where you're not using that much of the AI, but it's very, very cool. Also, for best results, your patients need to purchase a little scan box that their phone slides into. Has a bunch of mirrors. Pretty cool, but that's an additional cost. I found the software when I've demoed it difficult to use without the scan box. Really difficult. And I'm good with computers, and so are my kids, and they had a hard time. So if we had a hard time, your patients might have a hard time. So just saying. All right, next. Next one that probably came out was SmileSnap. So SmileSnap was initially invented more as a virtual consult way, a way to get leads in without having to have your patient come in the office for an exam. It's a HIPAA compliant way where patients can, send their selfies of their teeth. Always better if they have a retractor. You can view them, give them, information in a HIPAA compliant way, and then get them in your office to go ahead and do the start or to finish the records. But they also can be customized to be used for virtual check-ins as well. Price point, again, to onboard a couple $100. I don't know exactly how much it is right now. It might be more, and a couple $100 per month. Last I heard, it was for unlimited patients. So it's a pretty good value, but it's definitely more focused towards the virtual consult end and not the virtual check-in end, unless something has changed. Next one that came out is GP OrthoTracking, been around for a couple years. Of course, I love this one because this is the scrappy, underdog. One of my general dentist friends invented this just as there was nothing for him, at the time. This was too expensive. This really wasn't doing virtual check-ins. It was meant to be more like a tracking company. I like this one because it's a widget that goes into your website that patients can submit. Either you can be customized either for initial, virtual consults similar to this, or check-ins. You can be customized for phase 1, aligners, braces check-ins, bite check-ins, really anything like that. Price point is quite affordable, a couple $100s for onboarding, and I think it was somewhere like 100 to 200 per month, unlimited patients. Lastly, we have Align Flow. And Align Flow is kind of a newbie one. It has been in the market for a little while. They were using it for PT or physical therapy, and they just kind of got into the orthodontic market just recently. So Align Flow is pretty cool. It definitely was focused more. It's similar to SmileSnap, but it was focused more towards the check-ins, like a GP OrthoTracking, but it's not a widget that goes in your website. It is an actual app. One of the cool things about this one is that it can be white labeled, so that, like, let's say my company is StraightSmile Solutions, which it is. I can actually have it branded or customized or white labeled as a StraightSmile Solutions, like my own office check-in, and patients aren't going to know. It's not going to be called Align Flow. It's going to be all branded with your logo, your name, and it's an app that they can download from the App Store. Obviously they've got to get a password and put it in, and they can check in and not come into your office, but it can also be customized for all those other things we talked about, or even virtual consults. Onboarding, I think, is normally, they said $600 to $700. White label is about $5,000 to set up, and a couple $100 a month maintenance on top of the fee. And but they will do monthly. I think it was only like $200 a month. It's not bad for up to 100 patients. If you have less than 100 patients, they have a lower rate, but it's not month to month. You have to purchase 6 months up front. It's about half. So they're pretty flexible. And so is this one, definitely. I think the smaller companies are going to be a lot more flexible. This one's probably not. It's a mega company now. So anyways, and of course, if you're only doing Invisalign has its own virtual resources, but if you're doing other things besides Invisalign, I like to keep everything in my own dashboard. And I don't know how comfortable I feel having a monopoly, having access to all my patient records, checking in, everything like that. To me, it feels a little bit like Big Brother. You have to read the terms and conditions. What are they doing with these? How are they using my patient content and records in between to improve their own AI? To me, it feels almost like Big Brother is trying to, I don't know. I'm not that comfortable with that idea. And I would never only be doing Invisalign, so I like to have my whole office on the same platform and have only me have access to the records. At least with these ones aren't stealing your records or using it in their own dashboard. They're literally not even touching your stuff. They don't know, they don't care. They're just providing you the platform to do it yourself, So keep that in mind. All right, hopefully this was helpful. If you can just go to any of these websites if you want information. You might get a better rate if you go through me if you want an introduction, but totally up to you. All right, thanks so much.